Hi there, my name is Chase Glenn. I'm the Executive Director of the Alliance for Full Acceptance. AFFA is an LGBTQ advocacy organization based here in Charleston, South Carolina. We were founded in 1998, and our work really centers around education and advocacy. We see that as two sides to the same coin. Whenever we go out and we advocate with policymakers, business leaders, government leaders, and we talk about the change that is needed for LGBTQ folks, whether it's increasing protections, legal protections, and laws that would benefit LGBTQ folks, or in business settings, creating more inclusive work environments for people who identify as gay, lesbian, pansexual, transgender. We know that a lot of times people say, well, we're LGBTQ friendly, but they don't necessarily have a deep understanding about the experiences of LGBTQ folks. So we come in and we educate, we help people understand a little better, hopefully increase awareness, and we know that those sorts of interactions often lead to the change that we need to see for LGBTQ folks to help make this world a more welcoming and better place to live. So that's a bit about AFFA and our work here in the Charleston area. A bit more about myself. Again, my name is Chase Glenn. I use he, him pronouns, and I identify as trans. I'm a trans man. And for those who don't know what the term transgender means, if someone identifies as transgender, it means they don't identify with the sex that they were assigned at birth. So for my example, when I was born and the doctor held me up, they said, "It's a girl." And as I lived my life and began to understand myself better, I came to understand myself as not really aligning with and connecting with this identity that was female. And, as I continued on and went through a lot of therapy, I understood that I needed to transition in order to really, help improve my quality of life personally. And so I went and I started with a social transition. It really was basic, going by a different name, asking people to use the pronouns that I identified with, which were male pronouns, he and him, and sort of just trying that on. And as I socially transitioned, I really came to understand that was where I felt connected, and there wasn't this dissonance inside of me. And I ended up then starting a medical transition, went on testosterone, and have been on testosterone, which we call hormone replacement therapy, since January 1st of 2015. So not all that long. But I share all that to say what I'm going to talk about today, which is some of the experiences of LGBTQ folks within a healthcare setting, is that this is personal to me. I have had, a number of experiences that some would qualify as discriminatory within a healthcare setting. It hasn't stopped me. I joke that I'm a professional advocate. So for me, a lot of times when I'll have an experience like this, I try to make it an educational moment. I help someone understand why maybe that wasn't the best way to handle something or the best way to say something, and I move on. But for many members of the LGBTQ community, they understand that there's historical discrimination within healthcare against LGBTQ folks. And they also know that maybe they personally have experienced that sort of discrimination. And so when they have individual experiences like that, it can lead people to delay care or even, not pursue medical care that they might need if they have those types of experiences. So this is really important work. These are really important conversations, and I'm hopeful that this will help you understand the experiences of LGBTQ folks a little more, give you a little more insight, and help you understand how to best care for this community. So, like I said, this is personal to me, but I also need you to understand that the experiences that I'm going to share with you today aren't just about me. LGBTQ folks in our community have experienced discrimination. Like I said, historically, there are examples through many years of experience. But even still, we know that there are counselors. Some of them are not licensed counselors, but counselors within their community who will try to repair or convert LGBTQ folks. We call it reparative therapy. I put it in quotes because this isn't considered ethical by any licensing organization in our country, our state. But it's this idea that we can repair LGBTQ folks, convert someone who identifies as gay to be straight, convert someone who identifies as trans to be cisgender, which means you do identify with the gender that you were assigned at birth. And that sort of practice is alive and well in the state of South Carolina, and you can imagine how detrimental this is. But even still, I want to give you an opportunity to hear some data from our local community. In 2018, we started a project, Community Needs Assessment. And in 2019, we were able to release the report of a community needs assessment that we conducted in the Charleston Tri-County area. So this is Charleston, Berkeley, and Dorchester counties. We were able to survey over 1,400 respondents. We partnered with the College of Charleston and MUSC to conduct this survey. And we really wanted to capture a snapshot of what life was like for LGBTQ folks in this community. There was not good data out there about this community. A number of needs assessments are conducted every year, but at the time that we conducted this survey, none of those needs assessments had actually captured data around sexual orientation and gender identity. So there was no way to sort of parse out whenever you were collecting data about someone's home experiences or their healthcare experiences or their general quality of life when it comes to mental health. There was no way to look at the data that had been collected historically and say, well, gay people experience this or trans people experience this. And so we felt like that was a place where we could kind of stand in the gap and fill in some of the information that was lacking for our community. So, like I said, we started this needs assessment project in 2018, and it continued on into 2019. We released our report. We found that over 40% of our respondents said that their doctors, the providers that they sought for healthcare, didn't know their sexual orientation. And 50% of those we surveyed who identified as transgender said their doctors didn't know their gender identity. And such a basic piece of someone's identity, of who they are. And most often, the providers didn't know this information because they just didn't ask. We found that more than 1/3 of our respondents said they felt like their doctors didn't know the answers to their questions. And, it's one thing if a provider doesn't know the answers to their questions. It's another thing if they don't offer to actually go and seek out those answers. And so you can imagine, as an LGBTQ person, to seek out care, to know you want to, see a doctor for a certain particular need that you have. But if they don't understand this most basic part of who you are, how can they treat you? And in fact, that's what one person said to us when we held a focus group and we asked for people to explain some of their feelings and tell us more detail about their experiences. One person told us, "I don't think I've ever had a doctor proactively ask me about my sexual orientation or gender identity. If they don't ask for this basic information, how can they know how to treat me?" And that's the truth. For folks, it's not just about reproductive health, reproductive issues, which might be the first place you would go and thinking, oh, well, this is how this information might affect you. But as a trans person, being on testosterone, I need to have regular blood work conducted because, this increases chances for, issues with liver function and kidney function when I'm on testosterone. We know that it also can cause my blood pressure to go up. These are things that my regular primary care doctor need to know and understand, so that if they see something that sort of piques their interest, they might be able to connect that with the fact that I am on testosterone and I give myself an injection every 2 weeks. This is basic information. And how can our doctors treat us And how can our health providers really meet our needs if they don't have this sort of basic understanding about who we are? And so today I want to talk to you about sort of three ways that we feel like the healthcare community can sort of rise up to meet our needs better. Some of these things are happening already in different healthcare settings, but a lot of times they aren't. They're very basic, and hopefully it'll help you understand a little more about the role you can play in improving care for LGBTQ folks. So number one is communication with patients. It's important to normalize conversations around talking about sexual orientation and gender identity. Often, sort of the way that this is addressed is one, either the provider waits for the patient to bring this up, and then that's their cue to then maybe dig into it a little further. Oh, tell me about your sexual orientation, or tell me about your gender identity. But again, we think about the historical discrimination that has affected the LGBTQ community. So we know that a number of folks in our community aren't going to proactively bring this up to their provider out of fear for discrimination, maybe the anxiety that they carry with them about how a doctor might respond, how a nurse might respond to that type of information. Um, you know, so it's important to normalize these conversations in a way that we aren't just waiting for the patient to bring this up, or, and this is even more problematic in a number of ways, a provider looks at a person and perceives them to be different. And so then they choose to ask the questions about how someone identifies. Well, you can imagine that's problematic because it's outright discriminatory to look at someone and try to guess how they identify. Best case scenario is that we normalize these conversations and we ask these questions to every patient that comes in the door. There are three questions that we really want our providers to begin asking all patients. One is, what is your sex assigned at birth? That will give a provider one clue as to how someone identifies. Second, what is your sexual orientation? And third, what is your gender identity? And you might think, well, why do I need to ask gender identity if I'm asking sex assigned at birth? Well, it's just one more piece of that puzzle, and it helps you have a better picture of information so that you can ask additional questions as follow-up. But if you don't have kind of that starting point, you're kind of searching in the dark, and you're going to have to ask questions that will, potentially be awkward, and you aren't really sure how to ask them. And that's a part of this too. It's practice, and it's becoming more comfortable with having these conversations, and not only asking the questions, but then knowing how to respond. Because you may have an LGBTQ person that's like, wow, I've never had a provider ask me these questions before. But you may have also a patient that, has an ethical or religious concern about, how someone might identify, and they might have a problem with you asking that question. So you need to be prepared for if someone has a negative reaction to having those questions asked, how you're going to respond to that, how you're going to talk about how this is providing care for all people. And so we ask these questions to make sure that we're providing the best care for all of our patients, and then moving on. So, asking these questions and normalizing these conversations so that we aren't just making assumptions, we aren't just asking these questions to certain people, but we're asking them to all people. What is your sex assigned at birth? What is your sexual orientation? And what is your gender identity? And, the most basic place to do that is in our documentation, right? We start this process on an intake form. So that first question doesn't even have to be that you're asking the patient in the exam room, what is your sex assigned at birth? You're allowing people to self-identify on a written document. Often, the intake forms that folks fill out, before they even see a provider is limited. Doesn't give them the space to fill in sort of the information that's most pertinent to them. It doesn't give them the opportunity to self-identify. So it's important that we actually collect this information and then we document it. I'm going to share with you today some of my own personal experiences around healthcare. And one of my first experiences I'm going to tell you about is around documentation. I went to an urgent care clinic. I had a cold, and I went in to see the clinic. I went into the clinic. I was, thought I might need some cough medicine or something. And I went in, and they handed me the intake form at the counter, and I went back to my seat in the waiting room, and I began to fill out the form. And I saw that they actually were asking all three of those questions that I just told you were really important to ask: sex assigned at birth, sexual orientation, and gender identity. I should back up just a moment here. So sexual orientation, in case you don't know, is how someone, is attracted to someone romantically or sexually. So very basically, it's gay, straight, bisexual, or we sometimes say pansexual. They're sex assigned at birth: male, female, or also intersex, which means someone biologically has the characteristics of both male and female. And then gender identity. Most basically, that is cisgender, meaning you identify as a sex that you were assigned at birth, or transgender, meaning you do not identify as a sex that you were assigned at birth. And usually on an intake form, that would be, the option would be something like transgender man, transgender woman, gender nonconforming would be another good option to have there, and then cisgender, with probably a little explanation as to what cisgender means, because oftentimes people who are cisgender don't even know the term cisgender because it's not something they've had to think about for themselves. So back in that urgent, clinic that I went to, and I'm looking at the form, and I see that they're asking the questions that I've wanted providers to ask. So I'm so excited. I'm a total nerd. I'm in there, and I'm like, I'm getting to answer the questions I never get to answer. And so I fill it out, take it back up to the counter, and kind of making small talk with the person who's sitting there, inputting this data into the computer. I said, I saw these 3 questions here about, sex assigned at birth, sexual orientation, gender identity. Do you get many folks that, say anything about that? And the woman at the counter launches into this monologue about how I don't even know why we collect this information. It's too invasive, and we don't even put it into the system. I was shocked. She could probably see that look on my face. And I said, wait, what? You don't even put this into someone's chart? No, we don't even put it in there. And I'm like, well, why are you asking these questions if you're not actually even inputting this data anywhere? Well, I don't even know. I think it's too invasive. I think it's too personal. I don't know why we ask these questions. And I paused, and I thought, even though I have a cold, and it's a Sunday morning, I'm at an urgent care clinic, I really feel like this is an opportunity for me to educate. And I said, well, I don't know if you noticed on my form, but I marked I'm transgender. I'm a trans man. And I can tell you that having the opportunity to share that information on a form is really important. So often, my provider doesn't know that piece of information about me. I have to volunteer that. And so for me to be able to fill that out on a form and share that information is really key to a doctor knowing how to treat me. I said, I am concerned, though, about this not putting it into the system part. That is really concerning to me, because if I'm going to the trouble to identify myself, I'd like to know that that information is actually being used to improve my care. And she said, I know, but it's too personal. It's too invasive. I said, you know what? Someone doesn't have to fill out these fields on this form. But for the person who this does apply to, who hasn't been able to share this information with past providers, that is a really positive experience. And it's important to improving not only the health care of this individual, but of this entire clinic, this entire institution that this clinic is attached to be able to provide better care to an entire community. And she sort of shrugged, and I moved on. But that experience really stuck with me, because I thought, you know what, as the professional advocate that I am, this was a moment for me to share, a little more information about why that was important. But, for the average LGBTQ person, it would be really disheartening. And it might cause them to think, you know what, why do we even try to do this? Why do we even try to share this information? And for someone who's made even more uncomfortable, they might think, I don't know that I'm ever going to go back to this provider because I feel like they just don't get me. So That's one story. Another story about how this information and how we document it is so important is an experience I had at the OBGYN. I am a trans man, but I still have all the parts that mean I need to go and have an annual exam each year with a gynecologist. And so, I had shared with my provider multiple times, identified as trans. At the time that this experience I'm going to share with you happened, I was sort of in the middle of a legal process of changing my name legally and changing my gender marker, which means that on all of my documentation, it would say male instead of female. So that would be my driver's license, my social security card. Eventually, my birth certificate would be able to match my male, identity. And of course, then it also affects insurance, right? Being able to change that gender marker. But those two processes are separate from each other, changing your gender marker and changing your legal name. So I was able to change my name legally, but I was still in the middle of the process of being able to change my gender marker. And you should know this is a barrier for a lot of trans folks. It's an expensive process to go through the court process of changing those pieces of information. Gender marker is more complicated to change, so oftentimes that is actually more expensive to proceed with. And so it's a barrier for a lot of trans folks who aren't able to afford that sort of process. But for me, I'd had my name changed. It said Chase Glenn on my record, but I hadn't had my gender marker changed yet. So I'm sitting in the waiting room, the gynecologist office, and I, had started testosterone. I very much looked like this, which was presenting male to the public. So I'm sitting in the waiting room, and as you can imagine, that's already an anxiety-provoking experience, right? Having to sit in a clinic that is for women and to look very clearly male. And I'm sitting out there, and I'm waiting to be called back. And the person who opens the door from the office and steps out there has my chart in her hand, and she says, "Miss Glenn?" And I look around. She says, "Miss Glenn?" And I have to stand up in this waiting room with other women in the gynecologist's office, and I slowly walk back to, have my vitals taken and to see the doctor. And it was humiliating. My anxiety was through the roof. I felt so embarrassed. I felt so ashamed because I knew all these people out in this waiting room knew something was really different about me. And it ends up, I actually had to troubleshoot this on my own. Through Googling my doctor on the provider website, found that she actually did, 2 days a week, she spent time in the infectious disease department. And I was able to sort of troubleshoot this with her. And I said, "You know what, can I just come and see you in infectious disease and not have to go to the women's health clinic?" And she was like, "Oh, sure. Yeah, that's fine." Well, that was good. I was glad I was able to come up with that solution. But the vast majority of patients wouldn't have come up with that solution on their own. They probably would have said, "You know what? I'm not going to go back to the gynecologist. I'm not going to have that experience again. That made me feel so horrible." They might never see a gynecologist again. And you can only imagine all the different potential healthcare implications to someone who has not had a full hysterectomy, who still has all the parts and all the different things that are in somewhat working order, and how that could affect their healthcare down the line if they didn't seek out that care. So this is really important. This can make the difference between someone being healthy and not healthy. And it's not just a psychological thing. It's not just about mental health or how someone feels, but it has real life health implications. So we've talked about communication with patients, how we're having these conversations, normalizing these conversations. Second, we're talking about documentation. How are we putting this information in a chart? It's easily accessible for a nurse or whoever is calling someone back to see a doctor. And then also, of course, the doctor who's seeing the patient. How can they easily see in a chart someone's sexual orientation, someone's gender identity, the sex that they were assigned at birth? And then finally, it's also the unspoken messages that are given to patients. That's really basic. Talk about those intake forms again. not just asking the questions around sexual orientation, gender identity, sex assigned at birth, but also, just the basic language of, when you're, getting ready to have a baby. So I have a son who's 2 years old. My wife and I also are expecting another baby here in winter of 2020, expecting a baby girl. And a part of that process is, your doctor will send you to a childbirth class at the hospital so that you can get all the information you need when you're bringing home your first baby about, what that's going to be like, and what the birth experience is going to be like, and how to navigate the situation at the hospital, and literally, like how you get up to the labor and delivery floor, things like that. All throughout that class that was led by a nurse, they talked about the mother and the father, the mother and the father. And there was this assumption that everyone in that room had a male and a female mother and father. And you know what? For me, as a trans man who passes as a man, that information for me wasn't, something that necessarily was going to apply to me. I am the father in our parental unit. But there's just a very basic thing here where there are same gender couples. It's very common for same gender couples to have babies, and you're making an assumption that every parent formulation here is strictly male and female. It's an exclusive type of language that was communicated over and over. When we went and visited our son's pediatrician for the first time before he was born, we were filling out an intake form. The fields on the form said mother and father, instead of very simply parent, parent one, parent two. And that's the language. It's just such a subtle and quick change. Just talk about parents, or talk about, partners. Try to be a little more inclusive in the language we use. And then, in marketing and communications, which I know doesn't directly apply to you, but when we think about the clinics and the providers, offices where people go and visit, what are the visual cues that they're seeing? If there are flyers up on the wall about different types of conditions or medications, or the care that's offered from this particular clinic or practice, what are the cues, the visual cues? What are the pictures on these flyers or these brochures that might be sitting in a rack? Do you have representation of people who identify as LGBTQ? So they're visual cues that this is a safe and welcoming space for LGBTQ folks. All of this information isn't just about the very basic level of providing, quality healthcare within a primary care setting or within, any sort of healthcare setting. But it really can all come back to the mental health and the quality of life for an LGBTQ person seeking care. In our needs assessment, we found that 1 out of 4 of the people that we surveyed said they had considered committing suicide within the last year. So these are adults who identify as LGBTQ. 1 out of 4 told us they considered committing suicide within the last year. When you compare that number to the general population in South Carolina, that is 5 times the number of people within that general population in our state who've considered suicide within that same time period. 1 out of 4. So for many folks in our community, this is literally an issue that can mean the difference between life and death. If you view our full needs assessment survey on our website, you'll see that there are many compounding issues and lack of support that people in our community face. They oftentimes lack home support and social support. They have challenges within a healthcare setting. They have challenges at their workplace, and they have mental health challenges as well, feeling depressed and feeling anxious for an extended period of time, and suicidality. These are critical issues. And you may think that someone's experience in a healthcare setting is somehow just exists in a vacuum where it only affects people within that healthcare setting. But all of these different areas where someone has an experience that may be detrimental and may be negative related to how they identify, all these different experiences can compound on one another and can really affect someone in their whole life experience, their lived experience as an LGBTQ person. So this is critical work. Creating welcoming and safe clinical settings can really mean the difference between life and death for some LGBTQ folks. And my hope is that through this experience, through the education you are getting out of this module, that you will be better equipped to be not only just an ally to the LGBTQ community, but will be a part of the solution in creating safer and more welcoming and more inclusive healthcare settings for LGBTQ folks, because you really can make a difference in just those basic interactions and how you can provide quality care for folks who really do need it and are often not feeling welcomed and supported in many areas in their life. Thank you for wanting to make a difference. Thank you for wanting to do the work that you are doing. My hope is you'll take this information in and be the provider that all LGBTQ folks need. Be someone that is safe and welcoming and inclusive. Be someone who can really make a difference in the lives of an LGBTQ person. Thanks so much for the opportunity to speak with you today. Take care.